legs. It affected them quite badly. They were 90% covered for a good long time. They have repigmented. It now affects my feet, around my bum and my groin, and just on my elbows and my hands. When my mum first noticed the patches, she took me down to my GP, and I was quite lucky that my GP had already had a slight understanding of what it was. So we were referred to a consultant dermatologist. From there, they examined me, explained fully what vitiligo was, and gave me some options on different treatments as well. I've tried steroid creams. I tried these for 4 years, I think, on and off, because you can't use them for a long period of time. These weren't very effective on me. They are effective on some other people, it varies. So I stopped using the steroid creams. I was then told about a treatment called PUVA, which is a light-based treatment. This is where you go into like a chamber, like a sunbed, a stand-up sunbed, and you're exposed to a strand of light for however long you're recommended to be in there. From there, I went to the British Red Cross. They deal with camouflage, and what they did was they took lots of different samples and then matched it to my skin tone and then applied it. To begin with, I liked the fact that I was able to cover it up. Went on holiday one year, I applied it for the first 2 days, and then I just decided I didn't want to do it anymore. It's too much for me. Why should I have to sort of cover up what I am, basically? When I was first diagnosed, I didn't like wearing shorts anymore because it exposed the patches on my legs. I wouldn't take my top off when I was out in the sun because it exposed the patches on my body. And I became very depressed quite quickly. People would always be staring at the patches on my skin, and I would always be thinking, why do they have to stare at me? I don't like it, basically. My mum rang up the Vitiligo Society and explained the situation, and I was then put in touch with a group called Changing Faces, and they were a small charity at the time that deal with people with disfigurements. They do workshops and counselling, and they give you the tools you need to deal with people looking at you, how to confront them when it comes to it. And from then on, I think that's been a big change for me. I've looked at vitiligo in a completely different way. I now have a son with my fiance. We've been together for about a year now, and Harry was born 3.5 weeks ago. He's great, and I'm slightly worried that he might get vitiligo one day. However, the link is not much greater than how you would get vitiligo normally. With vitiligo, it can come at any age from 0 to 90. This is something that is unexplained, there's no reason for it. But what I would say to anybody who does develop vitiligo, especially in your older age because you don't grow up with it, is to seek out someone like the Vitiligo Society, because when you're first diagnosed, it is a chronic disease and it is something that will more than likely be with you for the rest of your life. Even though you're told there's not a cure, there are ways to deal with it, and there are things that can be done to slow down the process or even repigment the skin. So I would suggest seeking out someone like the Vitiligo Society to get the information needed.
Hello, I'm Dr. Rupal Shah. I'm a GP at the Bridge Lane Group Practice in Battersea in London. Coughs are incredibly common. It's one of the most common reasons for people to come and see their GP. Coughs are usually caused by an infection, whether that's a virus or a bacteria. They can be caused by other things as well. For example, in adults, occasionally acid reflux can cause a chronic cough. Cough is usually a symptom of an infection. That could be an infection of your upper airways, or in more serious cases it could be a chest infection, so a pneumonia. If the cough is a symptom of an upper airways infection, then usually you're not too ill in yourself. You might not have a high fever, you might feel reasonably okay in yourself, but the cough might be the main presenting symptom. In cases of pneumonia, usually you feel much more unwell. You might have a high fever, generally just feel awful, headaches, muscle aches. You might be coughing up coloured phlegm, although that can happen in upper airways infections as well. It matters very little actually whether the cough is dry or tickly or all these other things, and there's no really good evidence that any of the cough syrups you can buy over the counter do very much. More importantly is how you're feeling in yourself. So if you feel really awful and you do have the high fever and the headaches, then it might be worth seeking medical advice just to make sure that the infection hasn't gone down into your lungs. If your cough is caused by a virus, you may well have other symptoms, for example, a runny nose, sneezing, sore throat, all the usual things. If you do have many symptoms like that, then it's more likely that you've got a virus than a bacteria. And we can only treat bacterial illnesses with antibiotics. Coughs usually last for 2 to 3 weeks on average, so that's longer than most people expect. If a cough is more persistent than about 3 weeks, I think it's worth getting a medical opinion as to why. If you've got a history of lung disease, for example, if you've got chronic obstructive pulmonary disease or bad asthma, it's worth seeing your GP. If you're a parent and you're worried that your child isn't well in themselves, if they seem to be breathing more quickly than usual, if they seem to be a bit more lethargic than usual, anything like that, then it's definitely worth seeing your GP. On the other hand, if it's just that the cough isn't too bad in itself, but it doesn't seem to be getting better after several weeks, again, it's worth seeing a GP, especially if you're a smoker.
My name is Dr. Charles Shepherd. I'm medical advisor to the ME Association, which is a self-help support charity for people with ME/CFS. ME/CFS, it's an illness which normally starts suddenly, acutely. It often follows an infection, which may be a fairly trivial infection, and it tends to affect people in their 20s, 30s, 40s, although children can be affected, as can more elderly people. I first got involved with ME/CFS after catching it myself. I was working as a hospital doctor at the time when my patients had shingles, and I caught a very nasty dose of chickenpox from it, and that's what triggered my ME/CFS off in the first place. I think a lot of people don't realise that it's a very debilitating illness to have. It involves a combination of symptoms, but in particular muscle symptoms, exercise-induced muscle fatigue and quite often pain, brain symptoms, problems with memory, concentration, attention span, problems with balance, not being able to stand up properly, and also just not feeling well, continuing to feel flu-like. You put them all together and it's an illness which is going to affect every aspect of what you try and do. It's an illness which can, in most cases, be diagnosed by your general practitioner, but he can't do it in a simple appointment, so you probably need to ask for a double appointment if you're querying this diagnosis. Your GP really should take a detailed history to make sure he's not missing any other causes of an ME/CFS-like illness, because there are a lot of different illnesses that can present with these sort of symptoms. So after taking a detailed history, your GP will also want to do a range of investigations to rule out things like kidney disease, thyroid disease and other illnesses which can cause ME/CFS-like symptoms. If he's not sure, then your GP can refer you to a hospital specialist for a more accurate diagnosis. I think there are 5 key aspects of management of this illness. First of all is getting activity management correct, getting the correct balance between activity and rest. Secondly is the use of drugs, which can be helpful for treating things like pain and sleep disturbance, although we don't have a drug which is going to cure this disease. Thirdly is sensible use of alternative and complementary therapies. Fourthly is dealing with work and education where that's relevant. And fifthly is dealing with emotional, psychological problems if they arise. Unfortunately, at the moment, we don't have a drug treatment that will cure ME/CFS or effectively treat it. And this means that the outlook is quite often rather unpredictable. But we do know that people tend to fall into one of 3 broad groups. First of all are those who make slow but steady improvement. Secondly is a group in the middle who tend to follow a rather sort of up and down, rather erratic course, but they eventually stabilise and follow this pattern. But thirdly, there are a small, perhaps 20–25% of people with this illness who fall into a severe category, who remain housebound, bedbound, even wheelchair-bound with this illness. The good news for children and adolescents who have this illness is that on the whole, their outlook is far better than adults who have this illness, and a lot of them do return to full normal health. This is an illness that affects all parts of the person's life, not just the medical aspects. It affects their family, their relationships, their finances, what they do in relation to work, school, social activities, etc. And all these things are going to be affected by having ME/CFS, and they're likely to be affected for some time. So this is something that people have to come to terms with and get whatever help in the various different areas that they feel is going to make them, you know, improve from those points of view.
A dental abscess is a collection of pus that can form in the teeth or the gums as a result of a bacterial infection. How does this occur? Your tooth is made up of a hard white protective layer, the enamel, which covers and protects a softer yellow tissue called dentin. At the very centre of the tooth is the soft pulp, where blood vessels and nerves are found. Your tooth is attached to the jaw via a strong ligament, called the periodontal ligament. Bacteria are found in plaque, which is a byproduct of food and saliva. Plaque bacteria produce acid, which makes holes in the enamel that eventually reach the centre of the tooth. This is known as dental decay. The holes allow bacteria to invade the tooth and destroy the tooth pulp. White blood cells then pour into the affected area, and pus forms, producing a periapical abscess, the most common type of dental abscess. A periapical abscess is treated with antibiotics, and a permanent root filling is put in at a later date to prevent further infection. Sometimes an abscess occurs in the supporting tissues around the tooth. This is called a periodontal abscess. It is usually associated with gum disease, when the gums become inflamed and separate from the teeth, allowing bacteria to collect in pockets around the tooth root. Periodontal abscesses are treated with antibiotics and by cutting into the gum to drain the pus. Surgery is sometimes needed at a later date to reshape the gum. The tooth may also need to be extracted as a result of a dental abscess. If left untreated, the bacteria from the dental abscess can spread to other areas, including the nearby bone and the air-filled spaces behind the cheekbones. Infections that spread to the face, brain and neck can be life-threatening, but are rare.
I had a spot of bleeding, I could see it on the paper, which made me go to the doctor. And no one thought it was cancer, so I wasn't even fast-tracked, but eventually had a colonoscopy, which is a camera in your insides, and that showed very clearly that I had bowel cancer. I wasn't expecting it, but I wasn't surprised when I got the diagnosis and felt I was in extremely good hands right from the beginning. I had no severe emotion on being diagnosed. I just went into practical mode. Charles came with me when I was getting the results of the CT scan, because that could have been rotten news. Very often people need psychological and emotional backup. Make sure that you are asking the questions which will put your mind at ease, because it's not always the information you'll be given, and it's very helpful to have someone else with you. So I was in hospital for about 10 days, And then everything went fine. I saw the oncologist who said for my sort of cancer, it was a 20% chance of recurrence. With chemotherapy, that was reduced by another 40%. So in fact, very low chance of recurrence. The chemotherapy for colon cancer should be quite mild. Might have a little fallout of hair, mouth ulcers.